So blend mode 3 of monopolar electrosurgical unit. What is blend mode 3 of monopolar electrosurgical unit? Let us try to understand that. So blend mode 3 of monopolar electrosurgical unit. What is blend mode 3 of monopolar electrosurgical unit? Let us try to understand that. Before understanding this, let us understand how a monopolar electrosurgical unit works. So when we talk about monopolar electrosurgical unit, one very important thing that we all have to understand is that it works on the principle of fluctuation of current and voltage. And it can give you the cut as well as the power of seal. So cut and seal, both effects can be seen. But how do we see that? This depends upon the variation in amplitude of the voltage and the frequency of the current. So when we talk about the voltage is high in case of seal and the voltage is low in case of cut. When we talk about the current frequency, so the current is high frequency in case of cut, and when we talk about seal, it is low frequency current. This is very important for us to understand. The mechanism also, how this variation is helping the cut and the seal effect. So mechanism, when we talk about, suppose this is the tissue and you touch this with a pencil, and the tip of the pencil will have all the concentration of the current, and when the current flows at a very high frequency, there is ionic turbulence. So high frequency induces ionic turbulence, and because of this ionic turbulence, the ions are colliding with each other, and when ions are colliding with each other, there is generation of heat. So there is heat production, and this heat production causes evaporation of water. So the conversion of water, and where is this water? Inside the tissue. So the tissue moisture converts into what? The steam, and the steam will expand, and when the steam expands, there will be blasting of the tissue. So blasting of the tissue is the mechanism by which we induce the cut effect. So cut is like a bomb blast. Always remember that pure cut is the most dangerous version, and we should be avoiding using pure cut. Let us try to understand. When we say something is pure cut, what do we mean by pure cut? 100% on cycle. What do you mean by 100% on cycle? That means if you press the pedal or the button for 3 seconds, for 3 seconds current will be fluctuating and it will constantly be going, and for 3 seconds it will be bomb blasting the tissue. So this is very, very, very important. Therefore, we invented the blend mode. Blend mode is more safe than pure cut. And in blend, we actually blend on with the off cycle, So if you talk about blend 1, it is 50% on and 50% off. If you talk about blend 2, it is 40% on and 60% off. If you talk about blend 3, it is 25% on and 75% off. So if you talk in terms of safety, blend 3 is the safest mode to cut. Now when we talk about the mechanism of the seal, this is again very interesting. When you touch it with a high voltage current, so the high voltage current causes melting of collagen, and when there is melting of collagen, because of this, the melted collagen wants to convert itself into the steam, but it couldn't. Why? Because the frequency is low. So melting of collagen, since there is low frequency, the current is cut off. The current is cut off, and when the current is cut off, what will happen? It cools. There will be cooling of collagen, and since there is cooling of collagen, what will happen? It will get remodeled. So it is remodeled. This is how the things are. So it is remodeled. Now one very important thing is, What about the frequency kinetics? What about the frequency kinetics? The frequency kinetics is, it is 6% on, 6% on, and 94% off. Can you imagine? So this is how this works.